our desire for authenticity. You know, we want authentic opportunities and experiences. And I think that if we have, you know, at the community level supported by government, because my view is that government shouldn't be creating this stuff. It should be supporting what comes from the community. So it's a partnership with the community. And if we have people who are either entrepreneurs or are in not-for-profit organizations that have a passion for this and a vision, then we should find ways to work with them. And I think that we could create a lot of very interesting opportunities for people for authentic experiences around the Gaelic language and culture that would meet many needs. They would meet our needs, you know, in terms of preserving the language and the culture and promoting the language and the culture, and would have job opportunities, would have economic impact and spin-off. So the member would appreciate, I don't have a lot of time to give to this little office in terms of the larger the larger monster in the Department of Health. But if I had time, I'd spend more time with communities and people in communities talking about, you know, what do they think about that, and what are the kinds of ideas they have to do more development at a community level that government could support.
I recognize the member for Inverness.
Thank you, Mr. Chair. And thank you, Minister. Appreciate your comments. My next question is, and I'll give you an example of a project that might come from a community. And I guess the question would be, how would projects like these be encouraged by government? I don't know if you've seen, it was a short little film called Wake of Callum MacLeod. I saw it one night and I enjoyed it. It's a great little short film. It was really appreciated in Scotland, and it's been played on television there. And I know that I think there was a contract just renewed for another 3 years to keep showing it on television there. What can we do to encourage more of this activity? Because it's an example of, it was a Gaelic film, but you didn't even have to speak Gaelic to appreciate what was happening in the film, but it was in Gaelic, and so it's encouraging, you know, activity. It's turning the efforts of learning Gaelic towards the Gaelic economy. What can the government be doing to encourage more of this activity? Minister of Health.
Thank you, Mr. Chair. And I think one of the things that I think is beneath the Premier's decision to have a new department, the Communities, Culture and Heritage Department, was in fact to look at the, you know, putting the various offices into a larger department, was to get some synergy between the departments and between these offices. And I think that there is a lot to be said for not being isolated in wherever you are, being in a, you know, whether you're in a university department or you're you know, in a company or whatever, as a small office. I think there is a lot of synergy to be gotten when you work in a grouping that have similar but diverse focuses. And so the new department, and I know the minister of the new department, they're still doing the process of establishing a secretariat what that secretariat will do and realigning some of the services that will be provided and what have you. So I think that is one thing. I do know that little film, and it's hysterical. It's lovely. It's the funniest. If anybody hasn't seen it, they really should see it. There are lots of other things I suppose we can do. Actually, as you were talking about the film, as the member was talking about the film, I have a funny story to tell. I know the member will appreciate this. The CEO of the District Health Authority in Guysborough in the Strait retired after many, many years, and I think he's a resident of your constituency. Lovely man, Kevin McDonald. And they had the District Health Authority folks organized a little going away dinner for him, a retirement dinner at St. Andrews in Antigonish, and I was very pleased to be able to go. And that evening, Dr. John Chesson, who is he's not only a family doctor in the area, he's the president of Doctors Nova Scotia, was part of the head table. And so when he went up to the microphone to make a few remarks about Kevin, he started by talking about he had been reflecting on all of the names of the district health authorities, and that he had realized when you looked at the acronyms of each district health authority that in fact there was some sort of a Gaelic conspiracy going on, that in fact they were all Gaelic names. And then he proceeded to help us pronounce each one of the district health authorities in Gaelic according to their acronym. It was very funny. He did a very good job. And I think that there are many ways that Gaelic within the Office of Culture, which now has, an expanded arts division, will have an opportunity for those kinds of synergies that I talk about. I mean, so let's say there were, a production company and a producer who had a really good idea for a film, a small film about the Highland clearances and people arriving and setting up life in a part of our province. And they wanted to pursue this in some way. I mean, there they are. They've got a department that isn't just the Office of Gaelic Affairs now, but a department that's got all of these other entities, the Arts Council, or the Arts Nova Scotia, I think it's called, and different components that they would be able to, I guess the idea is kind of like more one-stop shopping for groups to be able to get access to different government programs and services and supports in a way that is much harder to do when you operate in isolation. So I guess that's how I would see where we're going in terms of being able to promote, and that would be that the same would be true for other of the small offices like the Office of African Nova Scotian Affairs. I think these offices will continue to have their distinct identity and purpose because they are very different. Their focus is different. Their audience is different. But there are great synergies to be had among these groups and then embedded in an office that has responsibility for museums, for the arts, and indeed for community development and and that whole idea I talked about, you know, the preservation and the promotion of culture has to come from the community, not from the government. It has to come from below and then find support at the top.
I recognize the member for Inverness.
Mr. Chair, I just have one last question for the minister, and it's the question would be: does the demand for learners, the increasing demand by learners, require additional investment to offer programs in more locations? And when I think about that, I think about what's happening at Highland Village, which you've referenced, and also things like Fashion Island. The programs they're offering there are as good as you'll find anywhere. There may be other people in the other locations of the province where people want to learn. Could those models be expanded? And would you be supportive of that? Thank you.
Recognize the Minister of Health and Gaelic Affairs.
Thank you, Mr. Chair. And the answer to that is yes and yes. I think that they could be expanded, and I think that probably we will see some expansion. It was really interesting. I have traveled the province over the years. There aren't very many places in Nova Scotia I'd never been to, because I love Nova Scotia and I love to travel in the province, and I've done a lot of it over my life. But the one area I had never been to was the Pugwash area until like last year, I guess. And I was just blown away when I went there. First of all, it's extraordinarily beautiful, and probably people who have been there recognize that. It's a really beautiful area, as is most places in Nova Scotia. But it has a very, very big, significant Scottish population. And all of the road signs up there are also in English and Gaelic, which was my first clue. I was kind of looking at these Gaelic signs everywhere I went. And then, so I started asking about it, and asking about, well, what's the history? And I found out, you know, a lot about the history of that area, Oxford, Pugwash, all in there. And it's fascinating. And this is an area that, you know, I'm not a Cape Bretoner. I say I always missed out on Cape Breton by about 15 miles. But so I'm not from Cape Breton. I'm from the Strait area, though. And, you know, I always think of the Scottish population in the province being in Cape Breton, Antigonish, Pictou, and what have you. And I really did not and was not aware until last year of the significant Scottish population in the Pugwash, Oxford area. And it's significant. It's got a fascinating history. Some of the churches there, the old Scottish Presbyterian churches, are there. You know, you'd see St. Margaret's of Scotland churches here, there, and everywhere. And the signs in Gaelic, and then a lot of the different, one of the little towns, and I'm not sure if it's Pugwash, or I think it is Pugwash, but a lot of the little streets, you know, very Scottish names on the streets and stuff like that, you know. And so I had no idea. It was really interesting. This is not an area where I think we have much presence as an office of Gaelic Affairs, and I would think that in the area there would be people. I know that there is clan activity there. Some of the various clans have reunions in that area, and you know, I think that there is probably a pipe band that has come from that area that I recall. So it all, you know, makes sense to me that there are other places in the province where there is a cultural, ethnic connection to the Gaelic language, and perhaps we should explore expansion.
I recognize the member for Inverness.
Thank you, Minister, for all of those responses, and thank you, Mr. Chair. Appreciate having a chance to ask some questions about Gaelic here. It's something that's very important to me, and I think as well to our province. I'm going to allow my colleague to continue asking questions for the Department of Health.
I recognize the member for Hants West with about 10 minutes remaining.
Thank you, Mr. Chair, and how the time flies. And as was the case the other day, I got up, I only had a few minutes to speak, and I'll try to pick up where I left off today and maybe get an opportunity to come back a little bit later on. I was speaking the other day with regards to dialysis in my area, and I went on about some of the numbers of patients in Hants community being a wonderful opportunity to expand dialysis for patients to keep them from traveling, both here to the city and, of course, to the Berwick area. I started talking a bit about the home dialysis unit and the training that had gone on there and what was required and how it just doesn't work for everybody. And I can tell you, Mr. Chair, that I just got underway in talking about the costs associated with some of these things and how there was some waste involved in that. If people didn't work out or people were done with this, there could be thousands upon thousands of dollars sitting there that ended up as waste because it couldn't be brought back. And this was from the people that are on the dialysis that were telling me these. I don't claim to be any great specialist, although I've got a bit of a medical background. I certainly have no extensive knowledge per se in something as specific as dialysis. Some background, but not extensive. I want to move on to some other topics because I know my time is somewhat short. I want to talk a bit about the mental health programs that we have. And I guess we've heard an awful lot about mental health, Mr. Chair, as we've come into this session. I know that you yourself have stood in this House and made comments, as have others, and I'm sure there'll be a lot more to be brought forward on that as we go ahead. But with regards to the programs and cuts to programs, I have received calls from families in my area who, I'll give you an example, who one day had a call saying, you need to remove your child from the IWK program that exists. We're thinking about sending him to Truro, but he needs to go home in the interim. So, of course, you can just imagine the panic that's instilled in this parent. The parent goes immediately into Halifax and gets on the phone, actually calls me from there, from her cell phone. There was a worker from the Department of Health there who did come on the phone and did speak, but no fault of her own. She was unable to explain. She may have been from the Department of Community Services, in all honesty, that was dealing with this file and with this case. She really couldn't give me any details. She had no authorization from anyone, although verbally she was given the authorization from the mom who was there with the child. And still she was hesitant to really get into that. And I can appreciate that, given her position in all of this. And it had all just transpired. And certainly I'm sure she didn't want to get into divulging much and didn't have authorization from the department or anybody above her. And, you know, that is what it is, and you can't blame her for that. She's following policy. But at the same time, I guess what we need to recognize is the fact that here we have programs that are being cut in a place like the IWK. And then we've seen the good folks that work there and others and families come out and they've protested along the front gates here in Hollis Street and around the building with their displeasure of where this is all going. Now, we all know the importance and the number of issues with regards to mental health in this province, whether they be in our youth or adults. And we know that youth mental health problems is a very serious issue for a whole variety of reasons. And we don't have to get into every one of them specific, but there are a lot of issues. I've actually been quite surprised in the years that I've been in MLA how many youth mental health issues that I've had to deal with. Unfortunately, and it is something that doesn't appear to be getting better. Although I think that some of the people that are working in those programs that we've offered have done very, very well. The people in community services on another local case that I've dealt with have been so involved. And these don't just come and go. These tend to stay throughout the course of these folks' lives, through young, some of them very young, all the way up through their teen years, and of course then into adult, and there's still issues. We've known long-term history, generational. Unfortunately, some of these things continue to go for many years, and we need to continue to improve that. And I know that as we stand here, we will work at that and continue to work on that as opposition. I know that the government is working on programs as well, and we need to make sure that the programs that are in place, the challenges that face us, and again, it all comes back to money. We all know that. We're here talking about the budget and the estimates. Everything, unfortunately, has to come to the God almighty dollar, I guess, when it comes right down to it. And I also know, and I appreciate the very fact that there is only so much money in that bucket. And I also know that the Department of Health takes up a very, very large portion, and we'll hear the minister later on quote that figure of what the estimates are for her department. It's tremendous how big that number is. What are we doing, though, to control it, is the question. And it continues. Although there's a small growth, there are cuts that are affected. Money changes, I guess, from one hand to another, so to speak, when it comes to specifying programs and where it's going to go. Now, I want to talk about a few other things, and I want to talk about home care specifically. And long-term care. Now, the minister, I know I've only got a few minutes left, and I know the minister's heard me say this before ever since I've been over here, and probably on the other side too, with regards to long-term care. We have had issues for many years with long-term care. The single entry system, I've stood here in my place and I've called it what it is. I've called it a failure before. I'll continue to call it a failure again, because that's what it is. The minister also knows that I've not only criticized this when she has been in that seat, I have criticized this in previous days when other members in this House, previous ministers, were in that place. That I disagree with that. I spoke with them and brought forward the concerns that were associated with the long-term waits. And I know that she's aware of all kinds, not just from my area, all kinds of individuals who have had long wait times to get into facilities. And it's too bad that this still exists. And here we are, we're talking about building new beds and opening new homes. We're not increasing the number of beds at all. It's really unfortunate that we built the new Windsor Elms, which is a beautiful facility, a wonderful facility, and we're very glad to have it. It was much needed. We have the same number of patients or clients, whatever you want to call them or refer to them as, residents living in that facility. It's too bad that was the time then to make a decision, knowing full well that our population was going to get older and our number of seniors and our number of needs and requirements for long-term care is only going up. What an opportunity it would have been to add to that facility very easily and made it maybe 150 bed instead of the 108 that it is. We instead continue to have seniors and others who are waiting for months and months and months and months for a whole variety of reasons to try to get where they need to be. I've got Unit 500 over there that remains full. That's hospital beds that are being taken up, but we've turned it into a semi-nursing home facility, and it's sort of the holding area while we wait to go somewhere, whether that's locally or we're going to ship them somewhere out within the 100-kilometer area. Again, this continues to be something that is not working, that we've seen absolutely no change in. And you can talk about all the new home openings that you want, and you can talk about introducing all the new beds you want. It doesn't seem to have an impact on the number of people that are always waiting. Now, people are continuing to get older, they're continuing to get sick, they're continuing to have to be, have care provided for them by way of long-term care and long-term care homes. Unfortunately, we don't have more beds opening up. Now, we've had a recent story, as we saw publicly on TV, who's a constituent of mine, Shirley Dykins, waited for a good many months, Her circumstance was a little different. She wasn't in Unit 500 or in the hospital, she was home. At the same time, she was being passed back and forth between sisters that were trying to care for her. But the stress is no different. The stress is very much there on those family members as well, who are looking after their loved ones. And it's a very, very, very difficult task. As much as you might like to think it's easy to look after one of your own, it's very difficult. It's even more difficult than having somebody in the hospital and being looked after, or in a nursing home and being looked after. It's stressful, it's tiring, it's hard. You never know if you're making the right decisions for their care, and you always want to do more and you want to do a better job for them. But Madam Chair, we continue to struggle with this. I don't know where we're going to end up, because you can talk about all the strategies and all the plans and all the studies you want. There has to be a solution somehow, and I'll get into it a little bit later when I have the opportunity. I know my time is drawing near. I only got a few seconds left here. But this is something that needs a lot of discussion, that needs a lot of work done in this area, and I look forward to some of that, and I know I'll have a few more comments on that But since my time has expired now, I will thank you and take my seat.
I now recognize the honourable member for Halifax Clayton Park.
Thank you, Madam Chair, and I'm glad to be able to get into my place in time to continue the talk that we were having on international medical grads. So it will be a medical question and not the Gaelic questions that I've been listening to as well in the last hour. I wanted to go back because I know the minister was rushed in her ability to answer. I only think there were 4 minutes left and we have a big subject before us. The subject is the international doctors who come here. They're trained and graduates of other countries. Many of them have practiced, for a considerable length of time in those other countries. And because I have a little bit more time, I think it's important to mention that our federal government has quite a disconnect with the professional associations as well, because they're going overseas targeting highly educated professionals to come to Canada. And they've really made a mistake or a discredit to the people that they're attracting, because they have not made it clear how difficult it is when they get here. I think there are some plans now afoot, which I heard at ISIS, that there will be more information online, and people that are living in another country, I'm thinking of doctors living in another country, can at least begin some of that process while they're still practicing. They can begin to get their credentials together, the educational certificates and so on that they would need, the transcripts that could be reviewed, at least get the process begun, and that might save them a year or so in where they are still practicing and the clock isn't ticking towards the time when they will not be accepted or looked at in Canada through the College of Physicians and Surgeons. And again, I mentioned there's a 5-year wait or time limit where it's felt that the person is then out of practice too long and would need more upgrading. That creates a great deal of stress, and I'm assuming that the minister as well has met and spoken to some of the people that are affected. There's a very high level of stress on them, and I said it was a very high stakes game when they go to the CAP exam, because so much rests on how they do, while they're being watched and monitored in each and every situation. And I have talked to somebody in the last year who actually took the CAP test the first time with very little preparation. She was able to get her name on that list, paid the thousands of dollars. I think it's $6,000 to sit that exam. I see the Minister of Immigration is interested in this too, and I think that's really important. It's a really it is a tragedy on a personal level to see people that are so highly educated and sought after by the federal government arriving on our shores with tremendous challenges to get their credentials. So I was hoping that, number one, that the minister could give me a copy of the breakdown of pension services or physician services, the other programs, just so that I could have it and see the total. It would help me. Otherwise, I could go through it again and jot everything down. So that's question number one. The second question is going back to the process that's in place. I understand that the minister relies, as we do with all the regulated professions, on that profession, in this case the College of Physicians and Surgeons, to run the assessment test. But my question is whether or not the funds available for the year are influencing the number that are given the nod, given that blessing that they're high enough prepared, that they've scored high enough to be accepted into the program. If somebody is scoring high, I think that they should be told that and not limited to 2 tries. It might be that there's just, if there were 70% of the people sitting that test that do well, then they should be told they've done well, but there's only room for the top 6. I mean, that happens with applications to medical school and other things that come up, that you're not in the top group, but it doesn't mean that you're a failure. And I'm just concerned that, as I said, the last year I had the figures for was 6 out of 36, and maybe a question for the minister would be, could she tell me over that period of time, we went over the period from 2005-06, that there were 8 groups that graduated or went through this OSCE, this clinical assessment. Could we get the numbers that sat the exam and the number that were successful each year? Because I know in the initial period it was also a very low number, and I'd love to see if that has increased in any way, and maybe we could just start with that.
The Honourable Minister of Health and Wellness.
Thank you very much, Madam Chair. And the first thing I would say to the honourable member is we will get you the information of the breakdown of other around physician services, other programs. What's in that? We will provide you with that. We're not going to do that right tonight, but we will provide you with a list of what's in that. With respect to the CAP program, as I indicated, this program, the Clinical Assessment for Practice program, is a program, it is not a program of the Department of Health per se. We do not, it's arm's length from us. It's a program that is run by the college. And so the number of people who sat the exam and all of that kind of stuff is information that is with the college. It's not with the department. We're not involved in that aspect. Our involvement is with respect to the financial envelope that is available for CAP physicians to be accepted with the CAP license and the return of service and the mentoring component with physicians around the province. And I guess, Madam Chair, I would say that, you know, this particular program is like every other program in the Department of Health. We have a budget for it. It isn't an unlimited amount of money. We set a budget. We have to be able to do that. Every government has done that. And you determine that that you have this amount of money. The college requests funding for the program based on, you know, their, I would imagine, perceived ability to place people around the province in terms of what kinds of openings and opportunities there would be. But we would not have an open-ended program. And I don't think there's any province in the country that has an open-ended foreign-educated physician program. If the member's aware of one, then I'd be happy to know about it, but I would be very surprised. I would think that the programs are limited, as I indicated. They're limited by the resources that you have available, and those resources aren't only financial resources, those resources also are mentor resources. So realistically, you have to look at the additional demand it places on your healthcare system, and educators in the system and practitioners in the system. And you know, I know myself, because as the member knows, I have spoken with many foreign trained doctors who haven't been successful in getting into the CAP program. Ironically, some of them Nova Scotians who have trained outside of the country as well, because being a resident of the province doesn't guarantee you access to a residency or a placement here in Nova Scotia.
The Honourable Member for Halifax, Clayton Park.
Thank you. And there's a number of questions that I sort of would like to follow up with there. One is that there certainly is an envelope of money, and you mentioned there's a return for service and mentoring fee and a few others. Can the minister say, do we give any money at all to the College of Physicians to administer the CAP exam? Are we doing anything to support them in offering that assessment, that clinical assessment?
The Honourable Minister of Health and Wellness.
Thank you. I think it's part of that program, that $2-point-some-odd million. We give them the lump sum, and part of that is to administer the program.
The Honourable Member for Halifax, Clayton Park.
Thank you, Madam Chair. The Minister will be aware that last spring we had the College of Physicians and Surgeons at Public Accounts, as well as somebody from ISIS who's worked a lot to try and bring all the parties together. And I must say she's a very diplomatic person who's working hard, and I think she's currently on a secondment with government to try and work hard on this issue. So we had a chance to look at it, and one of the things that the college said was that their members are subsidizing this program. And I have a hard time believing that if they had 36 people take the test the last year I know of, and they each were paying about $6,000 each. So that means to organize this day and bring in the simulated patients and the physicians to do it and book a room and whatever else happens afterwards, that's almost $300,000 they've gotten. 276 is what I got from these people themselves that very often have borrowed this money to take the test. So I did want to know if that would be something of interest to the minister, that if our money is also going there, I can't believe that they are not making enough money. I think, in fact, it could be a moneymaker for them, which would be a bad thing. I think they were trying to deny that there was any money to be made in it. But the fact is that there is the concern. They have the complete control over it, but we are at the other end receiving the successful people through and into the mentorships. So the question I would have is, does the College of Physicians know in advance exactly how many mentorships would be possible? How many at the beginning of the year, before they even sit the OSCEs or do the CAP? Do they know if you have, what is essentially a financial cap on the number that can be absorbed?
The Honourable Minister of Health and Wellness.
Thank you very much, Madam Chair. And yes, I believe, and I said earlier in my opening remarks on this, is that there are a set number of seats at 6 or 7, and they are aware of that. And to administer the program is about $200,000. So the rest of the money they get is to support the actual seats that are filled.
The Honourable Member for Halifax, Clayton Park.
Would the minister then assume that if the crop of IMGs that are sitting that exam have put in themselves about $275,000, that money is used to administer the program at the college? Or is it $200,000 is provided by the Department of Health?
The Honourable Minister of Health and Wellness.
I think, Madam Chair, that it's more complicated than that. I think that the system, as I explained, is also a national system. It's a national assessment and exam. I don't know what the costs are to administer, for example, the exam, and whether or not there are fees that are paid to a national body. But in the grant, if you will, from the department to the college is $200,000 toward administration of the program. But that doesn't necessarily mean that there aren't costs that the college incurs with respect to the administering of the national exam.
The Honourable Member for Halifax, Clayton Park.
Thank you very much. And I know I'm going to get a breakdown, at least somewhat, of the physician services, but if it's $4 million a year that we're giving towards the CAP program, would the rest of that be going to the number of people that the minister referred that are still in the process? I think it's a 2 or 3 year mentorship, so you'd have them at in different years of that. And so the $4 million would be going to give an extra amount to the doctor that mentors, and to pay the fee, or pay a salary to the new Canadian doctor or immigrant doctor that now has a license. Does it cover their salaries too?
The Honourable Minister of Health and Wellness.
I can't answer that with absolute certainty, but I think so. mean, many of the doctors who are mentoring are on fee-for-service, but they obviously receive some remuneration for mentoring the physician. So, but as I said, we'll get you that information.
The honourable member for Halifax Clayton Park.
Thank you very much. And I just have one final question. I know the health critic would like to come back and have some more. So could you just tell me, if, as the minister, if there's any other monies going in that would help in some of the other avenues that help immigrant doctors? And I'm thinking of some of the Capital Health District and perhaps some of the other health districts have some clinical positions or that they've made available where a person can come in and work at their DHA level in the hospitals. There's special categories. There's not many of them, but there are some. Are we deliberately trying to make space and positions for IMGs? And those have been successful, I believe. Are there any other, major funding initiatives that we're doing to help immigrant doctors? So if you could just talk about a couple of the others, and I don't expect it to be extensive in the answer, but if we could just highlight where the monies are going.
The Honourable Minister of Health and Wellness.
Thank you very much, Madam Chair. It is the case, and it's primarily in the Capital District, that there are arrangements that are made with foreign-trained doctors for certain specialty services. And this tends to crop up and be used from time to time in areas where there are shortages. Anesthesiology, excuse me, anesthesiology comes to mind as an area I know in the past that we really needed to do some recruitment around. So yes, that's the case, but it would not really occur outside of the capital, except on very rare occasions, I would say.
The Honourable Member for Halifax Clayton Park.
Can I just ask the minister if there's any pilot projects planned or anything further that we're looking at doing at this point to perhaps create another residency position through Dalhousie or again through the Department of Health? Anything that we're doing that would add to the numbers, because some of the very few, 1 or 2 immigrants are taken in, I think, at 3rd year in the medical school to come in and join that medical class and get a year or 2 of training at the Dal Medical School in order to practice and get on the track with other Canadians that are going through. Are we funding any new ones? Has the minister been asked to do a few more? And is there any plan to try another pilot or do anything that would help to move some of these highly skilled, well-trained people into back into their profession of medicine?
The Honourable Minister of Health and Wellness.
Thank you, Madam Chair. So a couple of things just for clarity, that the budget for the CAP program includes salaries for physicians for a 4-year contract, plus we pay for 13 months of mentoring. It's about $1,000 to $2,000 per month, the mentoring piece. Thank you. I indicated earlier that the department has undertaken the work of a physician resource plan for the province, and that work is close to completion. I want to impress on members that I and everyone else in the government and certainly in the department are very aware, and we're very sympathetic to the situation of people who are foreign-trained physicians who, as the member indicated, sometimes are recruited here through the federal programs. And I know in the federal election, there was great emphasis placed on recruiting foreign-trained doctors. to meet the physician shortage in Canada. But with all due respect to the federal government, they don't operate on the ground. They have no idea what specialties are required, and they have no idea where people need to be practicing. And so on some level, their efforts aren't necessarily helpful to the provinces unless there is coordination. And yes, you're correct, people end up here in these situations where they thought it was going to be easy because they hear this kind of conversation around doctor shortages, and then they find out it's not easy to get a position. So if there are shortages, what's the problem? From my perspective as Minister of Health, I cannot plan the delivery of healthcare services around the needs of people who are trained as doctors. We have to plan our healthcare system around the needs of patients and around the needs of communities. And I keep, through the budget estimates, talking to people about patient-centered healthcare. Healthcare that starts with planning for the patient. Healthcare that is about putting the patient in the center of the healthcare system and building a system that gets that patient care. And for too long, we've had a healthcare system that has been driven around the needs of people who work in the healthcare system and not around the needs of people who need healthcare. And we're changing that. The physician resource plan is very important because we have an aging physician population in Nova Scotia. We will see literally over the next 10 years in the province of Nova Scotia, hundreds of physicians retire. And we have to be sure that we have sufficient physicians being trained, and they need to be trained in the areas of practice that we need, that correspond with the population's needs in terms of chronic disease, in terms of our aging population, in terms of our rural population, a dropping population, and in terms of our urban population. So the physician resource plan is looking at the best predictors that we can have based on the data we have today on what that workforce is going to look like over the next 10 years and what should it look like and how do we ensure that we have it. And there will be the need for an action plan to address physician resources, and that action plan will have to take into account the foreign-trained doctor and their place in our healthcare system. And so because we have a CAP program today, doesn't mean we'll have a CAP program in the future. We may have a very different kind of program for foreign-trained doctors. I don't know what that's going to look like. What I would say is that, and I said this earlier, doctors are very mobile. They're mobile inside a jurisdiction like Canada, and they're mobile across international boundaries. And that's not going to change. We welcome physicians who are trained elsewhere. We will always have those physicians in our system. We have, it's quite interesting to see the number of physicians right now we have who are foreign trained in our system. We have a significant proportion of our physicians are foreign trained physicians today. And I mentioned being in Cape Breton with the Medical Society dinner, their annual meeting. It's like being at the United Nations. The doctors in Cape Breton are from all over the world. I think Dr. Nakvi told me that there were, 150 some countries represented in their physician population. And, it's certainly no different here in the Capital District. And you can go around the province and you will see the same thing. Gasha in Guysborough, Antigonish, Port Hawkesbury Strait area, there are very many doctors who work in that district who are foreign-trained doctors. So, it's not like the doors are closed to practice in Nova Scotia for foreign-trained doctors. That's certainly not the case. That's certainly not the case whatsoever. There's a very, very large proportion of our physicians are foreign-trained. And we do have this program. We run it in the way that I indicated. It's the College of Physicians and Surgeons that do it. There is money in this year's budget for it. As on a go-forward basis. We will have the physician resource plan finalized fairly soon. And then the heavy lifting of looking at how are we going to ensure that we replace an aging physician population will occur. How do we make sure that the physicians we need are in the places we need them? How do we ensure that we have the right mix? That we have specialty services, but we have that significant body of family practitioners and generalists that we require in a profession that has drifted more and more towards specialization, leaving the generalist on the sidelines. And so this is certainly work that's well underway and a conversation that we will be having with Nova Scotians and with our physician community in the very near future.
The honourable member for Halifax, Clayton Park.
Thank you again, Madam Chair. My concern a lot is around the CAP program and the number of doctors that have not got the door open for them. The door is slammed. A lot of them are, they're traumatized. They have come under false pretenses, maybe not enough information. They got top marks from the federal government, and as the minister said, there's a disconnect between what the federal government has given them points for in coming to Canada and what the reality is when they get here. I know we have a multicultural group in our healthcare system, and they are coming, through different avenues. Maybe some of them are older and came when it was a very different system, or easier to, or different, just a different way to be marked and assessed and brought into the system. But I know today there are a lot, many from the Middle East particularly, that are facing this countdown to the 5 years you've been out of practice and the countdown to having only 2 chances to take the CAP exam, even if they're willing to pay. And I'm not convinced that the CAP exam is actually measuring how good they are. I think it's looking for the top 6 or the top 7 based on what the government has available in the way of mentorships. So if that is the case, I don't think people should be restricted from having another go at it. They shouldn't have the door slammed in their face. So my final request, I guess, would be twofold. One would be to ask why they couldn't have more than 2 opportunities to try and go through that CAP assessment, and why, really, and get an honest assessment. And the minister used the words fair and transparent and open. It should be very clear that it really is measuring your ability, and it isn't a guarantee of a job at the end of the day. If people are taking it with the idea that there will definitely be a spot, that would be wrong, because there's only 6, let us say 6 spots a year. But it should be an assessment of whether or not they have the skills, not whether or not they make the grade for those 6. So I would like that to be clarified, and I think the minister should be aware that there's a lot of feeling that it is not a just system, that it's not as transparent and as open as it should be, and people are not sitting that exam with really the right premise, that it's a measurement of their capability rather than a measurement of how many the province will absorb. And I would like to mention again that something that's been mentioned to me is that there should be a preference for those who've already put down roots and have been doing their studies and living here in Nova Scotia as they prepare. Because remember, the OSCE or the CAP exam is the culmination of a lot of other steps that they've already taken, written exams and so on that they've gone through to be recognized by the National, Canadian Medical Association and so on. So the idea of giving preference to people who are actually living here rather than doctors who literally will have their family in another province, work for the week and then fly home to Toronto. One of my doctors actually in Clayton Park did exactly that, kept her family in Toronto and worked through the week and had an apartment in Clayton Park. So that's not the same as people making a commitment to our province. So because they're immigrants, I think it's a little bit different than the process that's in place for young medical students or even older people going back and going through medical school. I understand they have mobility, but these are people who've chosen a province to live in as an immigrant and then are going forward trying to make this their home where they can practice. So I think giving them preference would be a good thing, and perhaps the Minister or the Department of Health would have some influence, since the $200,000 a year is used to fund at least the administration of that program. And that's my final question on that. Thank you. I'm finished.
I just want to know, are you looking for an answer, or are you offering the floor to your...
Oh, no, I'd
Okay.
like an answer if I could.
Thank you. The Honourable Minister of Health and Wellness.
Thank you very much, Madam Chair. 30% of the physicians that practice in Nova Scotia today are foreign trained. So almost a third of our physician population are in fact foreign trained. And I say to the honourable member, I know her concern and I know that she's sincere. I know that she's met with many of these people, and I have indeed had the privilege of meeting people who have come here who have trained elsewhere. And they have very compelling stories to tell, and they are deeply disappointed when they are unable to secure a spot in a profession that they have already been practicing in some cases, or have trained for years for. So I certainly recognize this. But I have said, and it's my understanding, we don't administer the CAP program, but I often find myself speaking to people about the CAP program, and I never, personally, I never indicate that it's a program that I perceive as judging their capability. It is a competitive program, and I say that. It is a competitive program because it's not an open-ended program. It is a program that has a limited number of seats, and you write an exam, and the people whose results are the highest are the people who are successful. And it doesn't mean that people who aren't in the top 6 or 7 are flawed in some way. It just means that they did not end up in those top 6 or 7 spots. And, that's the reality. That is, we do not have an unlimited number of mentors, placements, or seats that are available. And so that is as far as what the standards are around how many times you can write these exams. Again, I would say to the member, this is a program that is arm's length from the Department of Health. It is not a program that I or staff in the department developed. This is a program that was developed, I believe it was developed out of one of the western provinces, but I stand to be corrected about from that. It's a national, it has a national set of criteria which has been agreed to across the medical profession. and they establish the standards, the rules, and all of that kind of stuff that will meet their professional standards. And so in terms of applying some political pressure on them to relax or to alter their requirements or their standards, I'm not sure that I feel comfortable doing that. It is, you know, it is a process, as I said, that the colleges look at. And I think that the colleges are the ones that need to set those standards, and just as they set the licensing requirements for physicians. And, you know, so this is what I would say. So staff are advising me that there is no limit on the number of people who can apply to the program, but they have to pass the test first, and that the college does establish the standard, and they would have to speak to those standards. I would like to table for the member the breakdown of physician services, other programs that she requested earlier in her time. Thank you, Madam Chair.
The honourable member for Halifax Clayton Park.
Thank you again, Madam Chair. And I wasn't intending to get up again, but I think it's really important to get to the distinction that the minister's made, that it's a competitive process. I think the immigrants that are sitting or entering into this final test are seeing it as a measurement of whether or not they have met Canadian standards. And if the aim is to get 6 people for the mentorships, and if 6 only are passing, people are being told you don't meet the Canadian standards, that you're somehow substandard, you have failed to pass. I think it's important that the College of Physicians be frank and honest. It's not about passing and failing in a knowledge level. It's that they are not the top 6. But these immigrants, each one of them are given their assessments back and shown where they were borderline or they failed. And I think that somehow it's not being, we're not telling the story straight to the people who are sitting it. And because they're limited to 2 shots, you know, even if they were deficient, they're not even allowed to come back for a 3rd try. So frankly, the door slams in their face, and they are more than dejected. They're often, you know, depressed, suicidal, ready to go home. They have to leave and go back to their own countries. Life for somebody who studied as a physician and now has the door slammed in their face, it really is like life is over for them. They are so devastated. But you're telling us, the minister's telling us, that really it is a competition for the seats available. I can accept that, but I don't believe that's the premise under which the college is approaching it. And that's why I think there's this disconnect that is really important that we get to the bottom of it, because, you know, I think only the minister can do it, really. The minister or the department could do that. Otherwise, we can't. And offering people the opportunity to pay the big bucks again to come back and try a 3rd time or future times would be fair if the limitation is the financial resources at the end of the day to sponsor them into the health system. That is a fully understood thing, and if that was the case, they would realize that each year they'd have the same chance to get in there and hopefully score higher and get those seats. And I just feel that we need to be an advocate for these people, because they've chosen Nova Scotia and they've been misled in so many ways, and we need to help them. They've worked hard. They have passed Canadian exams for knowledge, and they go into these high-stakes OSCE exams with a heck of a lot of stress, and you know, it's make or break for them. And they're often thousands of dollars in debt because they've been borrowing so much to get ready for these exams. So you can only imagine the stress on them. I'm not even sure it's an accurate reflection of their abilities. And with that, I'm going to turn it over to my colleague from Kings West.
The honourable member for Kings West.
Thank you, Madam Chair. And I want to first of all welcome Deputy Minister Kevin McNamara to Proceedings today. I thought perhaps maybe the minister brought him in to deal with Gaelic affairs, but I'm sure that's probably not the case. but anyway, I want to spend the remaining time of this hour dealing with some mental health questions and addiction services, and a couple are a little bit of a repeat because after, I guess, evaluating and looking at some of the responses earlier during estimates. So first of all, has the minister seen the final recommendations from the advisory committee working on mental health and addiction strategy? The minister now talks about it being very close to that point where we will have a public document. So I'm wondering if the minister has been apprised of some of the recommendations, seeing that some developments are taking place in the Capital District with the discontinuation of the 28-day inpatient program for addictions, and also the changes currently happening at the IWK. So I'm wondering if the minister has actually had some briefings on that document.
The Honourable Minister of Health and Wellness.
Thank you very much, Madam Chair, and I want to thank the member for the question. I think we've had quite a lengthy exchange around what's occurred at the IWK with respect to the shift in the model of service delivery there. So I'm not sure that we need to go through this that in terms of my providing any new information. I certainly can reiterate all of the information I've already provided, and I'm more than prepared to do that. However, with respect to the Capital District Health Authority, the 28-day inpatient program, I have been advised by the Capital District folks that this program was not being fully taken up. To the extent that the program had vacancies for more than 40% of the time. So even though we were resourcing it for 100% occupancy, 100% of the time. So again, we are living a reality that is this reality. The reality is that the dollars for health have to be used for health. They have to be used to deliver services, and they have to be used to give us outcomes. The days are gone when governments can't afford, and mind you, we never really could afford, but for too long governments paid for empty beds. We funded ineffective services that were not providing the kinds of outcomes we required. And the people who are often best able to determine that are people who work in these services, who observe this and who manage these services. Now, the folks over at the Capital District Health Authority in both addiction services and in mental health services have been looking at what the situation is and where are the weaknesses and deficiencies in their services, where were they receiving resources for services that weren't being provided, and how could they do things differently. And having their beds in the 28-day program empty for more than 40% of the time, even though they were getting dollars predicated on the assumption that those beds were full and people were receiving services at the same time as other programs had wait lists, and they were crying out for resources to address these services. They quite sensibly decided there's something we can do about this, and there's something we should do about this. And so, once again, like the IWK, there's been no cut in the funding to the addiction program. What staff have decided to do is to refocus their programs to reflect the patient's need, not the needs of the workforce that currently existed. And again, it's about providing patient-centered care. It's about providing services to people with limited health dollars. It's about eliminating waste and inefficiency in the healthcare system. And it's about getting better care sooner to people who otherwise would be languishing on a wait list until they developed into a crisis in some situations and require crisis services. So this is the situation in the Capital District with respect to the inpatient program, and I am fairly well versed on what occurred there, why it occurred, and I'm fully in support of that. In addition, the mental health services in the Capital District have also, in the last year or more, they have gone through some real analysis and real reflecting on their programs and what they could do better with their existing resources. And they have made some significant changes, and they've adopted some new models, and there are some very exciting things happening in that program, and I'm pleased to see these changes. And I have said on more than one occasion that it's not necessary to wait for a mental health strategy before you do things that need to be done. The mental health strategy is something that will help us move forward, but while we're doing the necessary research and planning for that, there are many, many things that we know from past pieces of research and various reports that have come along that need to be done. And so we have acted on those when we have the information and the resources and the planning is in place, and we're able to do that. And, you know, it's for that reason that we were able to do a number of things. Mental health courts, put funding into the EIBI program for autistic kids, and open up the psychiatric intensive care unit, move the forensic unit to Waterville from the IWK. And I want to say to the member from Kings West, I don't know if he ever toured the forensic unit on 4 South over at the IWK, but I was more than a little disappointed today to hear your leader say that that was simply shuffling services from one place to another. That was an unfortunate characterization of what will be a significant improvement in the care for kids in the forensic services, and a significant improvement for kids on 4 South who are being housed together in circumstances that served neither one of those populations at all. And the clinical staff at the IWK, as I understand it, have been crying out to government, the Department of Health, for a considerable period of time to address that serious problem in the best interest of kids on those units. And I have to say, when I toured the unit, it was crystal clear to me why they were asking for our help. And we acted immediately to address that. And it is anything but a simple transfer of a service from one location to another without any benefit to young people. This is something that will have immediate benefit to young people who are in both of those services, And I feel and have no difficulty. I understand the role of the legislature. It's a time for government to be accountable and held to account. And I am more than prepared to stand here and be accountable for decisions. But I'll tell you, comments like that around services that are so vital for our kids do not have a place in this place.
The honourable member for Kings West.
Thank you very much, Madam Chair, and thank you, Minister, for providing that kind of insight. It is indeed appreciated. Here's an area that could have some change, since I don't have a lot of time on this one. I will speak to a situation that I'm very familiar with and based on reports. In 2011 report on Middleton's 21-day program, alcohol at 69% and non-prescription drug use at 19% were the predominant treatment issues in patients accepted into the program. The Annapolis Valley Health received a report in March of 2011 about a pilot project calling the Screening, Brief Intervention, Referral, and Consultation Pilot Project. Now, this was a pilot project where they had clinical therapists from AVH Addiction Services placed at different local medical practices. After the 6-month pilot project, AVH reported that prescription drug use was the most frequently reported substance use issue with 48% of the clients, and this was followed by alcohol at 20%. The Middleton 21-day program seems to be focused on treating alcohol abuse when the community still requires much help on the prescription drug abuse issue. The only other option, methadone, and I know the Valley was pleased at the implementation of the methadone program, and doctors and other related professionals who have in fact taken advantage of the opportunity to be educated and to be also now have the required hours to be engaged in that program. But methadone, from the top experts, will say it's only a small portion of addiction recovery. So the question is, when will treatment programs in Nova Scotia change to reflect the needs of individuals seeking help?
The Honourable Minister of Health and Wellness.
Thank you very much, Madam Chair. And I want to thank the member for the question. The point he raises is a point that my own colleague, the member from Kings North, certainly has talked with me about. And the member from Kings North, as the member from Kings West would know, has worked for many, many years in the addictions field and has a very good knowledge of the developments in this field. And as have people in my department and people in the Annapolis Valley District Health Authority, such as Dr. John Campbell, who was here earlier today in our gallery. It certainly is the case that addiction services, I think, addiction services grew out of they grew out of a particular focus and tradition around alcohol abuse. But we now know that addictions are much more complex, and we have seen an exponential growth in the amount of prescription drug abuse and non-prescription drug abuse, coupled with sometimes alcohol abuse, not only in Nova Scotia, not only in the Annapolis Valley, not only in the province, but this is a phenomenon that you certainly see across the country in North America. And treatment programs are, I think, still trying to transform themselves to meet this new reality. And the people who are in the field tend to be the people who are examining all of the new treatment modalities and what is the most effective way to work with people, particularly people with drug addictions. And we also have, I think, a growing awareness and an understanding, although an imperfect understanding, of concurrent addictions and disorders. And when I say concurrent disorders, I'm talking about mental illnesses and addictions in combination. Our province right now is working to develop some joint system standards for concurrent disorders between substance abuse and mental health disorders. It's a very serious problem. It's one that we see more and more. And we have had a system that has separated mental health from addictions, where there needs to be much greater collaboration. So what we, I think, are experiencing are a number of different programs and services being tested. The member makes reference to a pilot project in his area. Pilot projects are a very useful way to test out new approaches and the effectiveness of those approaches, and to learn from them in terms of whether or not they need to be adopted more widely. So we are doing this. We are in the process of finalizing, as I indicated, the mental health and addiction strategy. And we will see a variety of measures that will help us have a better system, a system that will respond more to, again, the patient's needs based on what the data shows us of what those needs actually are.
The honourable member for Kings West, with 2.5 minutes.
Thank you very much, Madam Chair. With the new monies that are going to the Annapolis Valley District Health in this particular budget year, an identified line item, is that going entirely for the methadone program, or will it also impact some other work of addiction services?
The Honourable Minister of Health and Wellness.
Thank you very much, Madam Chair. And I think it basically does support the opiate treatment program. These programs, as you know, are not, they're not inexpensive. But at the same time, I think when we looked at the numbers, when the Annapolis Valley District Health Authority actually looked at the numbers of people on wait lists and people who are waiting both for services inside the district and perhaps may even have been receiving services outside the district, it was determined that a program of this nature was required. So that is the that additional amount of money is for that particular program. And I want to say to the honourable member that that program is being looked at from other districts. It probably will be a gold standard kind of program, not only for other districts, but for other provinces to look at. And one of the really unique features is kind of the dissemination of that program across various practices, so that it's not one practice that's carrying all of the load, if you will, that there are other a multiplicity of physician services around the Annapolis Valley. And this is really my hope for where we could go with similar programs around the province.
The time allotted for the official opposition has expired. Seeing no speakers on the Progressive Conservative Party, I recognize the honourable member for Bedford Birch Cove.
Thank you, Madam Chair, and I'd like to thank the Minister and her officials for coming in today. And to, probably not to the Minister's surprise, I'd just like to ask her a bit about the Lyme disease strategy for the province. Wondering at what point we're going to get the advertising underway, what plans there are this year. Is it any different from what we've done over the past few years? And just wondering how we're going to publicize this, and do we have any indication that Lyme disease-bearing ticks have moved into new areas?
The Honourable Minister of Health and Wellness.
Thank you very much. And again, this is certainly, Lyme disease is an issue that is of concern here in Nova Scotia. And it certainly is of concern in the area of public health. And the folks in the department who follow this are Dr. Bob Strang, our Chief Medical Officer, and his shop. And we know that the number of Lyme disease cases has increased in Nova Scotia from previous years. And we know that there is concern and fear in some parts of the population that this is a disease that physicians are unable to adequately identify or test for, and what have you. And I want to start by reassuring people that this is not the case. I had an opportunity, well, of course, I have an opportunity to be briefed by Dr. Strang on this, but I also had an opportunity to meet with some of the infectious control specialists as well, to get a better understanding of where they fit in the continuum of treatment for Lyme disease. And that was a very informative discussion with them. It's actually a relatively straightforward test for Lyme disease and a relatively straightforward treatment that is available to people who have Lyme disease. It's a disease, it's a serious disease that if it goes undetected, non-treated, it is very, very serious. So one should never minimize that reality. Undetected and untreated, it can be very, very significantly serious. However, the rate of detection and treatment is actually quite good. And I had a friend, in fact, who she lives in one of the parts of the province that was early identified as an area where the black tick is and where a carrier of Lyme disease. And she had the bite and the bullseye rash, and she immediately went to her GP, who started her on the antibiotic before the test results came back because it was so apparent that this was the case. And she was very, she was very successfully treated. And indeed, when the test results came back, they confirmed that this is what it was. And so it was, very, very straightforward. The thing that we have to do, according to Dr. Strang and people in public health, is we have to inform and educate the public around 2 or 3 things. We have to, first of all, help people in Nova Scotia recognize that the ticks are here, that while we've identified hotspots, that doesn't mean that the ticks are only going to stay within those hotspots, that in fact we need to be vigilant wherever we are in the province. We need to when we're out camping and enjoying the lovely outdoors in our province, we need to, first of all, if we can, dress appropriately. And if we are exposed, if our skin is exposed, and there's a potential for ticks, we need to check ourselves, and we need to do that, regularly, and we need to pay attention to those things. So we have to get involved in our own health care, make sure that we pay attention, whether or not we have a bite, if we have a tick on us, or what have you, and we need to follow up if we find a tick, if we are bitten, if we have one of these bullseye rashes, for example. There are 5 areas of the province where we know that the black-legged tick is certainly there in numbers that we should be concerned about. They are areas around the Galveston, Yarmouth County area, Pictou County around the beautiful Melbury Beach, Egerton, Kings Head, and Pine Tree, in Lunenburg County around Blue Rocks, Garden Lots, and Heckman's Island, First Peninsula, and in Halifax County, in Admiral's Cove out in Bedford, and in Shelburne County in Gunning Cove. Now, there's been surveillance through the Department of Natural Resources that has helped us identify where these ticks are. And we have a tick surveillance program in place. But as I said, there could be very well other parts of the province where we have ticks. We have, certainly birds and deer that move about the province and could be carriers. And there are several areas that have been identified for further field work, included Milton in in the Liverpool area, Queens area, economy, up in Cumberland County, and Maitland and Hants County, and in places in the Truro area. So I think, you know, the surveillance program with natural resources is continuing. The member asks as well about when we're going to be publicizing tick season and what to do and what to watch for. As we all know, we see now that we're entering into what seems to be the beginnings of spring. Let's hope so. It seems to be a little earlier than usual. So we are planning ads, radio advertisements, and other advertisements, and I think one is starting in a very few days, perhaps on the weekend sometime coming, to start the process. And what we do is we do some things at a provincial level, but every district health authority in the province has a medical officer of health who works with Dr. Strang as part of our public health program. And these folks out in the various district health authorities are the ones who are providing advisories and information into the local media, the local radio stations, and what have you. In addition, we work very closely with Doctors Nova Scotia. They have a regular newsletter to their members, and we get, when tick season is upon us, we get information into the newsletters of Doctors Nova Scotia, and we work closely with them in publicizing information and making sure that we have good, strong communications for public awareness. People do need to be aware that, you know, this is the possibility of being bit by a black-legged tick is very real, and we need to do as much as we can to protect ourselves. And however, as I said, we also want to increase people's awareness in terms of what they should do if they are unfortunate enough to be bitten by one of these ticks. The department will be working with our infectious disease physicians as this year as we've had in the past. In the past, we've done webinars, which is kind of continuing education for GPs around the province, where they can log on for a webinar with the infectious disease physicians here in the Capital District, and receive information and have questions answered, and what have you around the identification and the treatment of Lyme disease. And so these are some of the things that we do. We do advise the public of any new risk areas that we identify through the surveillance as soon as we have the evidence validated, and we will continue to do this. And the infectious disease doctors here in the Capital District are very familiar with this disease, and certainly they provide support to family physicians throughout the province. Thank you.
Thank you. I recognize the honourable member for Bedford Birch Cove.
Thank you, Madam Chairman. And I was remiss in not thanking the Minister for making those infectious disease doctors available to me. I did meet with them earlier this year, and they walked me through some of the process. I am still waiting for a couple of studies that they referenced about the treatment of chronic Lyme and placebos, so I would still like to get my hands on those. Not that I would have a clue what they say, but I could actually have someone with a scientific background walk me through it. What I did want to just bring up a couple of quick points around Lyme disease. Certainly, what I saw last fall was that people thought that since the summer was over, they didn't have to worry about black-legged ticks anymore, and they could play football outside with impunity in an area known to have black-legged ticks. And I'm not just talking about the odd tick. You usually go out there, and if you were to do a drag test, you would come away with a lot of ticks. So my concern is that people don't realize that, in fact, these ticks are active far longer than you would maybe normally think ticks would also be active. Another concern I have is that, in fact, the areas are expanding. I know that if you look online, and the Bedford listing, for example, just as Admiral's Cove, well, the ticks have gone well beyond Admiral's Cove, and the report, it's in all kinds of neighborhoods in Bedford, so I guess I would be concerned that that information be updated, because at this point it's not quite accurate from what I can see. We do need to get information out, because people just don't seem to be aware of the disease and what its symptoms are. And it's funny, because a couple of weeks ago I had dinner with a couple of doctors who are here they came from Winnipeg originally, where they had ticks and Lyme disease, etc., and they're quite comfortable with it because they grew up with it, and everybody knows how you're supposed to act. The problem is that we have not grown up with it. People don't know what to do with Lyme disease, and they often don't even realize that flu-like symptom they have, or that weird rash that they have, means something, and that they should go. So I would encourage the Minister to encourage people to get started on that particular information program, because I just really feel that a lot of the cases of people who have gone elsewhere for treatment might not to have had to do that if they've been caught early and had in fact had the proper treatment at the right time. From there, I was just wondering if I did want to echo my colleagues' comments on the foreign-trained doctors. I think there's nothing more heartbreaking than to talk to a doctor from, say, Iran, who has given up her practice, which was a successful practice, to move to Canada because the federal program said to her, oh, we want you. In fact, we're not going to even interview you. You're a doctor, you have a medical degree, you have a thriving practice, and you're in. And they arrive here and they get the shock of their lives to discover that, in fact, not only are they not in, they have to start over from scratch, they have to go back to school, and there's only a few spots, and it's not even like baseball. It's 2 strikes and you're out. You can't take it a third time. And you know, basically this person has moved halfway around the world. And my concern is that the federal government is doing one thing, the province has a different perspective, and in fact, the federal government needs to be told that what they're doing is wrong and they're causing problems for our foreign-trained doctors.
The Honourable Minister of Health and Wellness.
Thank you very much, Madam Chair. First of all, I want to go back to the Lyme disease issue. And Madam Chair, I would like to table the advertisement that will be appearing fairly soon. This advertisement outlines how to check for or prevent tick bites, and it's you know, one that the public health folks have been working on, and again, it's what will be appearing throughout the province. I have, you know, quite a substantial list of initiatives that our government have undertaken over the past year to inform the public of the presence of black-legged Lyme or black-legged ticks that potentially carry Lyme disease and what have you. I think that perhaps it's just because I'm a country girl at heart, and reality, I grew up in the country, so I do just assume that, you know, if in my constituency, let's say, there were black-legged ticks found in Fort Needham in the north end of Halifax, then I live pretty close to Fort Needham. I would pretty much assume that I don't necessarily have to go up onto Fort Needham to run into black-legged ticks. I'd be thinking about that every time I walk through the Hydrostone. But that probably is because I am a country girl, and I know how these things kind of work. So I get that we need to do a lot of information and communicating with people who don't necessarily think about how these things move from one site to another, how you know, a dog running up on Fort Needham and then running on the boulevards in the Hydrostone may have picked up and may transport some of these little critters, and this is how they travel. But I think, you know, the message certainly is that they're here. They're in the province. There are places where we have identified them in sufficient numbers to be concerned in those areas, and people need to take precautions. And those precautions are kind of commonsensical in a way. They're about how you dress when you go out into areas where the ticks might be, and they're about checking yourself after you do that. And I'm told that less than 1% of black-legged tick bites result in Lyme disease. And so I think while it is, again, a serious disease to contract if that happens, I think we need to put it in perspective, and we need to encourage people to do their utmost in terms of prevention and early identification, and then seeing their GP. You know, Lyme disease is a bacterial-based disease. And it's very easily treated with antibiotics. It's not, you know, it's not some unknown kind of infection for which there is no treatment. And I think that's really important, that we you know, reassure the public that it is something that is treatable, and its rate of occurrence is not off the charts. It's very small. We do have to be vigilant. Everybody has to be vigilant. And Lyme disease is not a reason not to enjoy outdoors either. You know, we really need to go outside, and we need to enjoy recreation in the outdoors. I think that's very important. Thank you.
I recognize the honourable member for Bedford Birch Cove. Birch Cove.
Birch Cove. We get Grove, we get Clove, we get everything. I'd like to thank the minister for that. I would just wanted to say, I think this looks very much like the ad that was out last year, which I thought was very helpful. I would just like to, sort of as a closing remark, because I know that the minister probably wants to get to her closing statement, that that a lot of people don't get the newspaper anymore, so if there could be a social media component to this campaign, that would be most helpful. Certainly having advertisements on the radio would be helpful as well, because sometimes people get Lyme disease and have no idea they have it, and if they don't get the paper, they're not going to know about it. So if we can not just do print ads, but include radio and a few other places, that would be awesome. Thank you very much.
I now recognize the Honourable Minister of Health and Wellness on closing remarks and to move her estimates.
Thank you very much, Madam Chair. Well, how time flies when you're having fun. I think that there were quite a number of things that I was thinking about saying in my closing statement, but I'm not going to. What I'm going to do is table a few documents that respond to questions I was asked. There was a lot of discussion, and the honourable member from Argyll was really interested in understanding the full-time equivalent situation in the department, and the way it is in the estimate books is confusing. I recognize that, I acknowledge that, and staff have done a fabulous job of breaking everything out and making it much more understandable, so I table that for the member. I also have a breakdown of where the almost $1 million in new money for dialysis is being spent. Last year where it was spent, and I'd like to table that for the member from Hants West. The only other thing I would like to say, and this is for the member from Cape Breton North, who asked me a question about the liberation therapy for MS patients and the clinical trials. He requested information on where the clinical trials were and expressed some disappointment that Nova Scotia had not set aside money as yet to participate in those trials. And just today or yesterday, we received an update from the federal government on where those clinical trials are. The research team that was successful in the application process has been chosen, but their research proposal now has to be vetted through an ethical process to ensure it meets the ethical research standards that all clinical trials have to go through. And when that has concluded, the successful research team will be announced. And I have information on that somewhere here in this pile of binders and email, and I'll fish it out and table it before we leave here today for the members. So that, I think, ties up any outstanding questions or issues that were raised. And at this point, Madam Chair, what I would like to do is read into the record the resolution on estimates for the Department of Health for the fiscal year of April 1, 2012 to to March 31st, 2013. So be it resolved that a sum not exceeding $3,861,513,000 be granted to the Lieutenant Governor to defray expenses in respect of the Department of Health and Wellness pursuant to the estimate.
Okay, seeing no other speakers, shall the resolution stand? The resolution is stood. We'll take a brief recess and then we'll adjourn committee closer to the hour of interruption and report progress. Thank you. approaching the hour of interruption, so we will now rise and report progress to the House.
The Chair of the Committee of the Whole House on Supply reports
that the Committee of the Whole House on Supply has met, has made some progress, and begs leave to sit again.
carried. We have now reached the hour of interruption, and the subject for late debate has been chosen earlier, submitted by the Honourable Member for Digby-Annapolis. The Honourable Member for Colchester North.
Thank you, Mr. Speaker. And I'm pleased to rise in my place tonight and speak to the resolution, therefore be it resolved, that the NDP government's education funding cuts are being felt in classrooms across the province, and we call on the government to invest in our students and restore funding to public education. Mr. Speaker, the issue of education and funding to education, the importance of education, have been debated in this House, and I don't think anybody would disagree that our future is very much linked to the education of our people. We often talk about Nova Scotia being the education capital. That is in reference not just to public education, but to our post-secondary. And we have stated repeatedly that economists are telling us that in difficult times, in times of restraint, one of the last places that governments should look for savings would be in education. And I think that message is understood, but our fear is, and it's not been, and what's been demonstrated by the current government is just the opposite. We do have a good public school education system, but it can always be better. And one of the priorities for any government when they're looking at education is try to identify the student needs and to respond to those needs. And those needs, Mr. Speaker, range from the earliest needs of our youngest students who are learning to read, to our graduates who are needing the skills that will allow them to go on to post-secondary or to employment so that they can become active and productive citizens. It is their ability to earn and give back to the economy of the province that will help us move forward. So the importance of education cannot be underestimated. The frustrating part for Nova Scotia